All right. Hi, everybody. Welcome to one of our AAC Community Learning Forums, also known as CLIFs. This CLIF is Learn About the Field of Optometry, and we have a special guest today who's going to be sharing a little bit about their experience. So a really great opportunity to learn about the field. I'm going to go ahead and pass it over to our guest presenter to introduce themselves and also just go ahead and get started with our presentation today. Thanks for being here.
Hi guys, I'm Dr. Jackie DeHaze Rice, and I'm going to be talking to you today about the eye-opening field of optometry. So first of all, quick little things about me is I was born here in Colorado, grew up in kind of Centennial Aurora area, graduated from CSU, then went on to optometry school at Pacific University, which is a little bit south of Portland in Oregon. Then after school, I moved to Denver and specialized in pediatrics for about 4 years, and moved up to Fort Collins, and I'm now practicing at Eye Care Associates here in town, and I treat anything from babies all the way to the elderly and anything really that walks in through the door. So what is optometry? Optometry is a specialized healthcare profession that involves examining the eyes and related structures for defects or abnormalities, according to Wikipedia. I know you guys like to source that, so. But yeah, so basically we use glasses or contact lenses as devices to help sharpen vision, manage and treat many eye conditions and diseases, and we work with other health professions to help maintain not only good vision, but overall health. I know one of you is interested in pharmacology, so we are constantly talking to pharmacists about correct doses for medications for patients, or if they have certain drug allergies or adverse reactions, trying to find correct medications for them. We work a lot with neurologists, treating patients who have tumors or strokes, just primary care professionals, helping go over like hypertension in patients or diabetes. So really we might just treat the eye, but the eye is connected to the whole body, so we are working with everyone. So yeah, if you've ever had an eye exam, you're familiar. We will always ask which one's better, one or two. This is as we kind of refine your prescription for glasses, but a lot of people aren't aware that we're doing more than that. And I think a lot of people are just like, well, that just seems boring. You're doing the same thing every single day with every single patient. And that's not it at all. It's a component of everyone's exam, but we do so much more. So an optometrist can detect over 270 health conditions, including certain cancers, autoimmune diseases, stroke risks, diabetes, hypertension, and more. And one of you had asked, hi, how do we keep our vision, protect our vision in natural ways? And really the simple answer is just stay healthy. Do not smoke, vape, whatever. Exercise regularly, eat your vegetables, go outside. When you are on computers, it's really good to just take breaks every 20 minutes. And stay properly hydrated too. That's a huge thing, especially here in Colorado. So if you guys aren't from Colorado, it's a dry state. And so people don't realize how much hydration can affect the eye. And then just to kind of go over these pictures to kind of show you how they're related is this very first one. This woman came in for an eye exam. She was seeing great, glasses were great. She just needed a new prescription. We regularly ask people if they want us to take pictures of the inside of their eyes to help assess their overall health. And we found this tumor inside her eye. Tumors in the eye are really rare, but we do want to catch them because they can easily spread to the brain. So basically, this lady came in for an eye exam and we saved her life. This other one is corneal scarring. So people can get infections in the eyes, especially if they're not taking care of their contacts, and that can permanently affect their vision if they don't get in soon enough. And so with something like this, we can use special contacts made out of amniotic membranes or special drops to help kind of reduce the scarring to help restore their vision. If we can't, they might need to be referred out to get like a corneal transplant. And this one down here is one we see all the time. I had mentioned earlier that we kind of co-manage people who have diabetes. The reason why is we are able to see blood vessels in their natural state without doing biopsies, without doing any invasive surgeries. And so the diabetes in general can really affect our blood vessels. And so what we're seeing here is blood vessels are bursting in the back of the eye, causing bleeding that's affecting their central vision and causing swelling of our nerve fiber layers. And so we are seeing it in the eye. It means it is happening throughout that whole body. And that means that that diabetes isn't being well controlled, and they can have a bunch of different complications. So we are always trying to check diabetics every year to make sure that they are taking care of their health. Other ways to practice optometry is, like I said earlier, I specialize in pediatrics, so you can do that. There's Indian Health Services. The bonus of that is when you work for like public government agencies, sometimes they'll forgive your loans. So by working with the IHS, that can be one way to get your student loans forgiven, which is always a bonus. Working at the VA, working in an OD-MD practice. So that's optometry with ophthalmology, which are eye surgeons. That could be as simple as like LASIK. So the optometrist would be checking patients' vision before they go into surgery, and then making sure that they're healing well after surgery. Or here in town, you may have heard of Eye Center of Northern Colorado. They're our big surgical center. And they have retinal specialists and corneal specialists, glaucoma specialists, and they all have optometrists that work closely with them to help them manage these patients. General practice, which is what I do. So basically anything that walks in through my door, I will see. And if it's something that I can't treat, I will make sure they get to the doctor that can take care of them. So like that one with the tumor, that is not something I can treat. So we sent her to not only an oncologist, but also a neuro ophthalmologist because the eye is so closely tied to the brain. We want to make sure that that's getting taken care of. Then there's also research in visual sciences. Our school was working really closely with Nike, and they would do anything from doing special colors on soccer balls for players to make it easier to see, or trying to find exercises to help train the systems to take regular athletes into elite athletes and then to Olympians, or like special contacts, really anything you can do with research. And then there's also education where you can just teach at universities. I had a couple of classmates who went straight into that after school and they loved it.
Jackie, I have a question about one of the ones that you mentioned. What
Sure.
is VA?
Oh, VA, so the Veteran Affairs. So you can work in medical or military settings. So not only do you like work on military bases, but for the Veteran Affairs, they have a full eye clinic there. And so you are treating any vets. So it could be as young as someone 18 who started with the military, all the way through people who have been retired for years and years. When I was working on there, yeah, I'd see a huge age range, but it is specifically people who worked for the armed forces and are no longer active.
Thank you.
All right, yeah. So how to become an optometrist? Well, you have to get your optometric doctorate. And how you do that is you get your undergrad degree, but you do not have to specialize in science. You can do whatever you want. Like, I know some of you are pharmacology majors, biochem majors, apparel and merchandising, computer science, it looked like too. That's great. Do whatever you want, whatever makes you happy. But you just have to make sure you get the prerequisites to get into optometry school along with that degree. And then one of you guys have asked about the GPA. I remember it from when I was going through the process that most schools preferred a 3.2 GPA. But then when I looked at this, this is a link here that I'll give you guys access to. They are saying 3.0 or higher is a good GPA. And then as you're approaching the end of graduation, or at least applying for optometry school, you take the OAT, which is basically their form of the GRE, and they want a score of 300 or higher, but I saw like 320 is really ideal. But that is like kind of like they like that, but they will take other things into account. So if you don't score that high, but you're really personable, you're really good at problem solving on your feet, they look at all that with like interviews and stuff like that too. So it's not a hard fast like, oh gosh, like I have like a 2.9 GPA, are they gonna let me in? It's just, it's easier to get in with that. And then you will go to 4 years of optometry school. The last year is usually a preceptorship. What that means is it's like these little mini residencies. So every 3 to 4 months, you change to work in different clinics. So for me, I worked at a VA hospital. I worked at a military base. And then I worked at a contact lens specialty practice, and then just like a general practice. But people also worked at like the Mayo Clinic for their preceptorship. They were all over the place for that. And then as of right now, a residency is optional, and they're usually just a year. So that's a lot better than the medical school where it's a 4-year residency. Yeah, so this one's optional. And usually if you want to work in VAs, if you want to work in hospitals, if you want to work in IHS, the Indian Health Services, those require residencies, but a lot of other places don't. And I was actually told when I was graduating, they're like, hey, if you want to do something, if you want to specialize in something, just go out and do it. The residency is nice, but it's not something that's required. So I chose to start working since I had been a student for too long. So how I came into optometry. One of you guys asked what my biggest challenge to education was. It was this, actually. I did not know what I wanted to do with life. I wanted to be a teacher, but my older sister decided she was going to be a teacher. And I didn't want to do what she wanted to do. But I had kind of thought about optometry because it was something I was always exposed to because I was in glasses when I was 6. But when I went to CSU, they were like, okay, well, like, what are you thinking about? I was like, well, optometry, but I don't really like science. And they're like, okay, well, let's not do that. And so I just went in as an open option major. And for 2 years, I was like taking just random classes thinking maybe I want to do psychology, maybe I want to do sociology, maybe I want to do paleontology, because who doesn't want to be Indiana Jones, you know? And as I got more advanced in those kind of classes, I realized they just weren't for me. And so at the end of my 2nd year, CSU was just like, hey, you need to decide on something. And I was just like, well, I'm still kind of thinking about optometry. So they suggested I join the pre-optometry club, which I think is still active. And they just brought in a bunch of doctors and we talked about what they were doing. And every time I heard these doctors talk, it made me fall more in love with the profession. And then I started shadowing them, and it was fantastic. And so the more I learned, the more interest I got. And so I decided to pursue that, and I have been happy with that decision. I love my job. But yeah, so trying to decide that was definitely the hardest. The next part was I am a huge procrastinator. And so applying took me longer than it should have. I was just like, oh yeah, I'll just write those essays later. I'll just do that. And I ended up taking a gap year, but that actually was nice for me. I think it was something I needed. And then convincing my parents to let me into optometry school because it's not cheap. And it was making me move far away because there is not a school here in Colorado. And my mom was not ready to let one of her children move far away. So I was just trying to convince them of that, which reminds me, I do want to go back on another slide. So these are links that you can have access to. This first one's basically going over all the different schools. There's 23 of them and what each of their prerequisites are to get in. This one's just a huge resource about anything you want to know about becoming an optometry student. These three are all about the same, but it's basically, what do optometrists make? On average, they're saying probably between 105 and 128. It's kind of a big range. For some reason, East Coast doctors make more money than West Coast. So sorry, we're kind of in between that. But if you aren't from Colorado or know you want to live somewhere else, you can kind of be like, hey, I really like this state. How much money do optometrists make in that state? And you can kind of look that up, and that's kind of nice. And then WICHE. WICHE is huge. This is a program that for states that do not have an optometry program, they will pay part of the tuition to kind of offset out-of-state costs. Just like all school funding, it is always under attack. So we've been really trying to advocate keeping that around. And right now, Colorado residents are still able to apply for it. And I think for me, they paid around $15,000 a year towards my tuition, which was a huge, huge, huge help. And that was one of the ways I was able to convince my mom to let me go too, because she was just like, you're gonna go into so much debt. And yes, you are, but there's programs like WICHE and other programs that can help kind of offset those costs. So that was always nice.
Jackie, I want to jump in real quick.
Sure.
I just want to check in, Denise, if you have any questions. Sorry to put you on the spot. Feel free to use the chat or unmute yourself, but is there anything that like you have questions about so far?
I'm good right now, thank you.
Okay, sounds good. I do also want to share that when Jackie, when you talked about like the prerequisites, another great resource that I think students should also like be taking a look at right now at CSU is the PreHealth advising resource that's on campus, and that's for students who are interested in various like PreHealth resources or fields. Sorry, I'm going to link it in the chat for you, Denise, but for other folks, some folks might already be meeting with advisors in PreHealth, regardless of what major you're in. What's great about that website is that you can go in and look at the prerequisites that like CSU is recommending based on what they offer for different areas like optometry. And so check it out. If you don't meet with anyone in PreHealth, look at PreHealth and you can just schedule to meet with anyone. Since they don't assign students like an advisor, you can have to seek them out, and they always offer really great also networking and like workshop opportunities, just like here, like the one that we have today. So this is like great resources because these links are in the presentation and not available on our website or in the chat. We'll go ahead and share the presentation with all AC students so that you can have access to the links. And so just keep an eye out in your email for that from us later this week. Thanks, Jackie.
Yeah. And to be honest, when I was applying to school or thinking about school, I don't think I actually even use any of this. I think I use specifically CSU resources. While it doesn't feel like it was that long ago, you guys had a book that you actually went through for profession by profession and what the prereqs were. And I had that book like memorized for exactly what I needed, but I imagine that's all on the website now. But yeah, and so that just like really helps. And that's what's nice too, is like I said, you don't have to necessarily, like I was a biology major, but you don't have to be in biology. You don't have to do biochem. You can choose. I think we had people who did carpentry, nursing. We had I think some teachers, like just, and some engineers that they just decided that maybe that was their major, but they weren't really interested in it, but kept going along with it until I got their prereqs for optometry school. So yeah, CSU has great sources. I just forget about them because I'm not a student anymore. Sorry, guys. What I do enjoy about my job, like I said, I love it. I get to spend time with my patients. I get to know them. I don't feel like I'm just like just cranking people out. A lot of like ophthalmology, who are eye surgeons, their job is so problem focused that most of their appointments are only about 5 minutes. And so we'll get patients saying like, oh gosh, like I feel like I didn't even know my doctor, but this way I actually get to know them, and through talking with them, I am able to identify what problems that they're having with their vision, with their health, to kind of help better treat them. Yes, I did pediatrics for a while, so I still have a special fondness for kids, and seeing it help them gain confidence and do better in school. I think there's actually like a statistic that a lot of people who are in the jail system actually have uncorrected prescriptions. And so they did poorly in school, and so it kind of affected their long-term life. And so it's great to know that like by me getting glasses for a kid, I can help them be successful in society later on. So and then finding problems that can potentially save lives, like troubles with diabetes, the tumor, so many other things. High blood pressures, you can sometimes tell if someone's at a higher risk for a stroke. And so if you can catch those things before it's a problem, like your patients are really thankful, but it's a good feeling. And then I also have worked a lot with a lot of low income families, and families who legal status is maybe not quite there. And it always shocks me how many times I'm told, thank you for treating me like a person. I think these populations are so used to being pushed to the side or dismissed. And it bewilders me because I try to help everyone equally the same, no matter their background. And so it makes me feel really good when people tell me that I'm doing that. So anyway, so is optometry right for you? Really, you need to love helping others. You need to love being social, because you are talking to a lot of people. I have a lot of friends who are introverts, and this job would just drain them. And then, do you enjoy science? I laugh at this because, like I said, I went into CSU saying I don't really like science, but I want to become an optometrist. I do like science. I just don't think I liked the science classes that I had taken. And so I think it's more important, do you like to learn? And do you go out and, like, if you have questions, try to research it and find it, because that's a really important aspect, is trying to problem solve for your patients. If you're unsure about this, there are some related fields. There's ophthalmology. So those are the eye surgeons. So basically, instead of going to optometry school, you go to med school, learn everything about the body, and then you do 4 years learning about the eyes. And that's when you get more into the surgical side and specialties. You don't have to be a social because usually those appointments are only about 5 minutes. There's vision therapy and occupational therapy. And basically these people use exercises to help strengthen your visual system, to help with certain conditions like turned eyes. You know, a lot of people who've had concussions, strokes, that they've kind of forgotten how to properly use their eyes, or they've done damage to their eyes and they need to like learn how to work around it. And so these people can help them with that. Optometric technicians, these are my support staff. So these are the people who help do all the pre-testing for my patients. They really get to know my patients too, because they're in there for a long time. They will scribe for my exams, and just kind of help support me in how I take care of my patients. Then there's the opticians. Those are the people who fit glasses. So the people who help you pick them out, adjust them, fix them, make them. And then there's medical sales. So any medical device needs a salesperson. These people really need to be social because you are selling. So that can include any of the equipment, the cameras that we use, the scans that we use, the drops that we use, the frames, anything. But that is a different path for a lot of people. So my main advice about optometry and just finding a career in general is talk to the people in the field. So if you think you want to do pharmacology, go talk to a bunch of pharmacists. Don't just talk to one, because you'll get more of a general feeling of how that actual job is if you talk to more people. Shadow them. It's really easy to be given the sales pitch like I'm giving you guys today, but to know if it's something you actually like, it's very different when you're sitting in the room as these specialists are actually performing their jobs. And so you can see if that's something that increases interest for you or decreases interest for you. Research it. Research what you want to go into. If it's 100 different things like it was for me, research it, see what kind of paths you can go down. I don't feel like my high school did a really good job of doing like career day or anything like that. So I don't think I knew a lot of careers that were out there. And so that's, again, how I came into optometry, is something that I knew. But I've learned of other jobs, and like the research side of it is just crazy. I don't like research, but there's so much to it that like, I can't believe there's so many sides to it that there probably would have been something I would have liked to. And then find resources to help you accomplish your dreams. So like I said, Witchy was a game changer for me. It helped me pay off my student loans sooner. It helped my parents have better ease of mind, letting me go off to do it. And really just like helped me through school, like knowing like, okay, like I can afford to buy my books, I can afford to do this. So there's just ease of mind for that. And remember, it's okay to change your mind. Don't just because you're like 3 years into your major and you realize it's not for you, that's okay. I have a lot of friends who they stuck with it even though they knew they didn't like it, and they're still miserable and they're still thinking about going back to college. And I think it's easier to change your mind now than to wait in a field that you've worked in for 15 years and hate it and have to restart it. On the other side of it, I have friends who did go to optometry school, worked as optometrists, and no longer are practicing, and they're happy and it's fine. Like it's a lot to take on, but if it turns out to not be your calling, it's okay. And I think people need to hear that more often. And then again, you guys will get access to this, but these are just some helpful links. These ones are from optometry students. One's just talking about why she chose optometry. And then another one's just kind of doing a Q&A session. And then these ones are from practicing optometrists. And one's just kind of like a really quick, like, this is what my daily life looks like. And then the other one is why he chose optometry and what makes him happy about the field. So I think that's pretty much it. This is just kind of a fun link here where you can kind of see what it looks like to be nearsighted or farsighted, have glaucoma, cataracts, weird things like that. If you have any questions, feel free to email me. That's my email address there. I get a lot of junk emails, so maybe in the subject line, write, I'm a CSU student, so I don't delete it and don't ignore it. And then this is just one of the sources that I used. So yeah. Any questions for me about anything?
I have a question, Jackie, but I just want to first check in if Denise has any questions. Denise, do you have any questions?
No, I only, well, my question was how you guys gonna share the links, but you already answered that, so thank you.
Yeah, of course. So just keep an eye on that. There were a lot of like really helpful links that Jackie talked about. So I think it'll be really awesome for folks to follow up on those and do a little bit more research just to get more information on it. I do have a question, Jackie. Are there any like, I know you talked about like shadow someone. Do you or any colleagues offer any like shadowing opportunities or like internship opportunities?
Yeah. Internships are hard, but we do allow shadowing. We have also hired current CSU students who either work for us during the summer or kind of part-time through the year. We don't like doing that because it does cause a kind of a burden on the staff because we're open all the time, but there are some times that we allow like just kind of like a part-time position to work in the setting and see us more. But definitely I work with 5 other doctors. We all are very passionate about optometry and we would all love to have students come and shadow us and see what we do. And we're all very different people, so you'll get different views of our field from that.
And so it'd be like safe for students to potentially connect with you via email for any.
Yeah, so just email me, say if you want to shadow, we'll have to work it out. And yeah, that would be fine.
I don't have any other questions. I definitely encourage folks to check out the presentation, use this recording as a resource to continue exploring different fields. Again, there are a ton of really awesome links that Jackie talked about from the presentation. So thank you for offering that. Those will be sent out to students in an email. So definitely use that. And this recording will be available on our Thrive website. If there are no other questions, I just want to give a huge shout out again to Jackie. Thanks for being here. The hope is that we can offer more opportunities for students to learn about different fields. And the hope is that Jackie can be one of basically like an employer that we can continue to connect with in the future for folks to learn about this field. So thank you again, Jackie, for being here. Thanks, Denise, for being here. So yeah, I'm going to go ahead and stop recording. I will say, just for folks who are engaging with this at a later time, or for yourself, Denise, make sure to fill out the AAC CLF evaluation. Sorry, that's a cat. Right at the last minute, to fill out the CLF evaluation in regards to just like feedback before May 6th.